All right, so if you have any questions during the webinar, please feel free to submit your question through the Q&A function. You can find it in the top right of the Zoom window or under the three dots under More. So during the webinar, please do not use the chat function, which you can also find in the Zoom window to submit your questions. Please use only the Q&A function. I hope you enjoy it, and I will pass it to Marina to welcome you.
Thanks, Ali, for the introduction on how to navigate today's webinar. My name is Marina Uehara, and I use she, her, and hers pronouns. I am the Director for Student Engagement in ISSS, or ISSS, the International Student and Scholar Services here at the University of Minnesota Twin Cities. If this is your first time joining us, welcome. I would like to be one of the first to welcome you here to the University of Minnesota as a future global Gopher. By the way, the Gopher is our official mascot. That's why we endearly call you all global Gophers. If you have joined us before in the webinars and you're wondering, who am I? It's because I have been on maternity leave and I just returned last week. So I'm super excited to get to meet so many of you here today. I was just looking at the waiting room and one of my colleagues mentioned there's many of you who have been joining us throughout the whole summer. Fun fact, I, just like many of you out behind the screen, I used to be an international student from Argentina. This was many, many, many years ago, but I remember July, and I remember what it was like to prepare to come here to the university. Packing 2 large suitcases. I packed what I thought was an appropriate winter jacket. Side note, it was not. But I also remembered I had a lot of questions around vaccinations, immunizations, healthcare. How will I ensure that when do I see a doctor? How much will it cost? How will I focus on my well-being while living on campus? And I am also aware of how complicated the US healthcare system can be and look like, and also how difficult it might be living by yourself for the first time. This is why we have invited several experts here across the university and partners outside of the university as well. But I will let our leader extraordinaire, Amora, to introduce you on who these speakers will be for today.
Thank you, Marina, for the welcoming remarks. Hi, everyone. My name is Amora Batbayar. I am a Senior Supervising Global Gopher Experiences Leader at ISSS. And I also know moving to a new country can be very stressful and very overwhelming. I myself is an international student from Mongolia, but we want you to know that you're not alone. We have so many professionals and student leaders joining us today to help you navigate the US healthcare system. So we will be having our professionals from Housing and Residential Life, Austin Hollick, also from Boynton Health, we have Daniel Arzola, Office of Student Health and Benefits, we have Greg Thurston, and Blue Cross Blue Shield of Minnesota, Katie Smith. And of course, we are very lucky to have our ISSS staff here who can answer questions related to ISSS requirements, your I-20, your visa, or other immigration-related topics. And finally, we have our amazing student leaders here too. And you have already heard Ali present earlier. We're very excited to share our own experience, and we hope that hearing their stories will help you feel connected, supported, and confident that you can thrive here as well. And next, I would like to hand it off to Austin Hollick from Housing and Residential Life to get us started.
All right, thank you. Hello, everyone. My name is Austin Hollick. I work in Housing and Residential Life at the University of Minnesota. Let me just get my notes up here so I can remember all the great important things I need to share with you all today. So today I will share some important information about on-campus housing. First, let's start with some important dates and information. Housing and Residential Life provides housing to over 7,000 students on our campus in 12 buildings. We provide opportunities for students to meet each other and have staff on site as a resource for you. And in addition, we have almost 40 unique living learning communities in our residence halls where students can live in a community with others that share the same academic goals or personal interests. Our fall housing move-in dates are as follows. We provide early arrival housing for international students from July 27th to August 22nd in Centennial Hall. Early arrival housing is only available for students enrolled at the university. We cannot accommodate family members or other guests during that time. Move out is Friday, August 22nd by 6 p.m. But for those who are living on campus in the fall, we will provide transition time and transportation assistance if needed that afternoon and early evening. During our fall early arrival housing, our Pioneer Dining Center will be open in July and most of August. However, make sure to check the schedule in the dining webpage for hours of operations because some dates during that time are unavailable for meal service. Dining is not included in that early arrival housing cost. So if you plan to arrive early and are interested, you can purchase dining dollars to use in the Pioneer Dining Center or other retail locations on campus. Move in for new fall residents who live on campus will begin August 15th for our apartments and August 25th for our traditional residence halls. Assignments will be emailed out to you at the end of July. And at that time in July, you should reserve a move-in appointment prior to moving in. Make sure to apply online for early arrival housing if you need to on or before August 25th so we can accommodate you before you move into your fall location. If you have a roommate, you can learn more about connecting with your roommate on our website. And if you have not yet found fall housing, we encourage you to utilize our off-campus listing service at listings.umn.edu. Okay, next slide, please. Your health and safety is important to us at Housing and Residential Life, and this page provides some information from you regarding health and safety on campus in our residence halls. As a student, it is very important to take care of your own well-being, and there are several opportunities in your hall to connect with others on information, including jobs within Housing and Residential Life, so you may work where you live, or create and participate in one of our many groups. There's a lot of ways for social interaction and to get to know the people around you. So you can check out our website for more information if you're interested in that before you arrive on campus. Our staff are able to assist you as a resource in each hall community, but we all play an important role in maintaining safety in our halls. In particular, if you experience or witness a bias incident where you feel discriminated against in your home or in your residence hall, please report it as soon as possible to your hall staff, or you can submit a report to the Bias Response and Referral Network so we can provide support and follow up. You can learn more information about bias reporting on the Bias Response website. I'll now pass it over to Daniel, who will talk about Boynton Health Services.
Hi, good morning, everyone. My name is Daniel Arzola. I work for Boynton Health. My pronouns are they, them. I'm here to talk to you about Boynton Health, what is probably your best option to get healthcare in the campus as a student. First, I wanted to mention that Boynton is a historical place. It's been around for more than 100 years, and it's a dedicated place to empower students to take control of their health with over 100 years of experience. We understand that navigating a new healthcare system can be challenging, and that's why we're committed to make it the process as smooth as possible, supporting students in every step of the way. Another thing that I wanted to mention quickly is that we offer interpreter services. So when you make an appointment at Boynton, if you feel like you need to explain your situation in your own language, you can get interpreter services at Boynton, but you need to be sure to request those services when you make an appointment. And I'm going to teach you in other slides how to make an appointment. But let me tell you about our services. Boynton is a place, it's like a universe where you can find many, many services just in one building. So we have primary care, mental health, a pharmacy, physical therapy, dental, eye clinic, gynecology, vaccinations, and nutrition clinic. Like all these clinics are located just in one building, right on campus, with a care team who works together. And don't worry, our health providers are not students. They are or grad students. They are all medical professionals with years of experience in their respective fields. We have several locations, but our main location is in the East Bank in Minneapolis. That's our main clinic and offer all the services that I just mentioned. And we also have a smaller clinic in St. Paul, which offers primary care, mental health, physical therapy, nutrition, and a Gopher quick clinic services. Our main clinic, as I mentioned before, is on the East Bank and is open Monday through Friday during general business hours. But if you need help outside Boynton's hours, we have a website when you can check a nurse line that works 24/7. So you can call at any moment if you're not feeling okay and just talk about your symptoms and they can help you. And additionally, you can receive mental health services on the West Bank and physical therapy if you visit places like Breckwell. That's the gym on campus. I also want to talk to you about immunization or vaccinations. The university does have an immunization requirement. In this case, it's going to require the vaccines that you can see here in the slides. The MMR, that includes measles, mumps, and rubella, and the recommended for meningitis A, C, and B, the HPV series. Those are 3 vaccines. Hepatitis B, varicella. Also, the Mpox vaccination is available and recommended for those who are meeting the eligibility criteria. So Boynton, in other words, Boynton is your place to get vaccinated on campus. We have different programs to access vaccines. Sometimes you just can come to our drop-in clinic, so you don't need to make an appointment all the time. But in case you want to make an appointment, just check our website. I want to talk to you also about quick care options. We offer 2 quick care options to help you feel better as quickly as possible, with same-day appointments for the Gopher Quick Clinic. This can be made online or by phone. Also, the GQC treats symptoms like COVID, flu, strep, and other minor conditions. When I talk about GQC, it's the Gopher Quick Clinic. I know people use a lot of acronyms in the United States and can be confusing sometimes for us, which English is not our first language. But for more serious symptoms, such as pain chest or high fever or injuries or cuts, you just can visit Orient Care at Boynton to get immediate attention. Both services are available during regular business hours. If you want to check more information, just please check our website. And you can check our website quickly, just going to Google Boynton Health, or just visit our website. All the information is there. We also have a dental clinic with dental benefits. We offer 2 quick care options to help you feel better as quickly as possible. Same-day appointments. Oh, give me a minute. Sorry, I was mixing the slide. Okay, we have a dental clinic. You can call the dental clinic to make appointments. The dental clinic can offer you teeth cleaning, x-rays, comprehensive exams, and deep cleaning. And if you have the student health benefits program, you can have all these services at no cost. But once my coworker Greg talks to you about insurance, I think he will gonna explain this more. But our dental clinic is have experts that can help you, and you can make an appointment through our website or calling. I'm gonna talk to you also about the mental health care on campus. Boynton Health provides a supportive, confidential environment where students can seek professional mental health. We offer a range of services, including counseling, psychiatry, group therapy, which is very popular, and walk-in and urgent counseling. We also offer telehealth counseling appointments. That means that you don't need to be in place. You can have therapy using your computer. Which can be very useful when you are a student. And you just need to choose the kind of session that is best for your scheduling needs. This support not only benefits students' immediate well-being, but also plays a key role in their long-term academic and professional success. So it's important to take care of your mental health while you are going to the university or while you are a student. And talking about mental health and keeping your well-being as a student, I want to talk to you about other two programs that we offer. One of those is the food pantry. Nutritious You Food Pantry is open during the student year, and basically it's a food pantry where you as a student can come and get groceries for free. You need to prove anything, just go there and you can get fresh food for free. I recommend to check our website or follow us on social media, because we normally post the dates where the food pantry will be open on social media and our website. And we have now locations in the East Bank, St. Paul, and West Bank campuses. In the East Bank is in Kaufman Union, and it's as easy as just showing up at the food pantry and get groceries and fresh food for free. Another popular program that we have is PAUSE. I will say it's our most popular and cutest program, which stands for Pet Away Worry and Stress. And every week, therapy dogs, cats, bunnies, and even chickens can help you to provide animal-assisted interactions that help reduce stress. PAUSE is great. So if you are walking around campus and see that PAUSE is happening, I recommend you to join PAUSE. Sometimes spending your day with a dog or a cat can change your day. And you can check about our dates in boynton.umn.edu/PAUSE, or follow us on social media, and we always post information about when PAUSE is happening. We also have a pharmacy in Boynton. The Boynton Pharmacy is staffed by pharmacists and support staff who are experienced in addressing student health needs. Is located conveniently at our East Bank Clinic. Our pharmacy offers a wide range of products tailored to support the health and wellness of students and their budgets. Our pharmacists take the time to educate patients about their new medications and are always available to recommend over-the-counter products. You can also visit the Boynton Pharmacy website for an easy, secure way to transfer prescriptions or learn more about the products and services we offer. We also offer free safer sex supplies at the pharmacy. And it's very easy to transfer your prescription to the pharmacy. Their staff is great, and I recommend doing it. Visit our pharmacy. The staff is great. And finally, I want to say thank you for your attention, for being here. Again, there is no way to remember all this information I have shared, especially when you will need it, but visit our website. All the information is there. Our website is boynton.umn.edu, or use this QR code for all I have shared today. And now I will pass to Ali or to Greg.
Yeah, I think I'm next.
It's Greg. Okay.
Hello,
Thank you,
everybody.
Greg.
Yeah, no problem. Thanks, Danielle. I'm Greg Thurston. I'm the director of the Office of Student Health Benefits. Could we go to the next slide, please? Thank you. I want to highlight today the health insurance requirements for the University of Minnesota, as well as some items related to health insurance in the United States that may be different from health insurance in your home country. Health insurance in the United States is complicated. I think Marina maybe led off the presentation mentioning that. And, even for those of us who were born here. So I've lived in the United States my entire life, and it's still, there are still things that I learn every day about it. And so in the few minutes that we have now, I can really only give you a general overview of how it works. There is a booklet with all the health coverage information that's known as a summary plan description. That's actually over 100 pages long and is posted on our website. So you can see the website information here. And if you want, go and check out that booklet. After the presentation, you'll likely have additional questions in the future. So we've got the contact information here for our office, and we want to make sure that you feel comfortable calling us anytime in the future if you have questions, because we're committed to helping you with any questions that you have, either now or in the future. First, it's really important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be on either the university's student health benefit plan or the university's graduate assistant health plan. This requirement has actually been in effect for 50 years and applies to all university students, both domestic and international. It's necessary so that you can focus on academics and not worry about whether you can obtain medical services if any health issues arise. Waivers from coverage on the university are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. Only the countries of Oman, Saudi Arabia, United Arab Emirates, and Kuwait have arrangements allowing waivers. If you qualify for a waiver, you should email the Office of Student Health Benefits for assistance with the process. If you're a graduate fellow or graduate assistant with a qualifying appointment from the university, you should enroll in the graduate assistant health plan. The university pays a significant portion of the premium for graduate assistants, so your contribution is low. At the beginning of the semester, your account is charged $234.78, and if your appointment is 50%, you pay no additional premium. If your appointment is less than 50%, you will pay an additional amount for the semester based on your appointment level. You must complete an enrollment form to enroll in the Graduate Assistant Health Plan. To enroll, you go to our website, shb.umn.edu, and select Graduate Assistance, then select Enrollment. Complete and submit the form to the Office of Student Health Benefits. I do want to point out that you need to actively do that because failure to actively enroll in the Graduate Assistant Health Plan would result in the graduate assistant being automatically enrolled in the Student Health Benefit Plan and charged its full cost of coverage. And you can see that the cost of coverage for the Student Health Benefit Plan is significantly higher than the cost of the Graduate Assistant Health Plan. So that's why all graduate assistants want to make sure they enroll in the Graduate Assistant Health Plan. Graduate students without appointments and all international undergraduate students who don't qualify for a waiver must enroll in the Student Health Benefit Plan. The cost of the Student Health Benefit Plan is $1,795 per semester and is billed to your account at the beginning of the semester. To enroll in the Student Health Benefit Plan, click on Enroll Me on the insurance plan communication that will be sent to your MyU account. The Office of Student Health Benefits does not recommend purchasing any additional insurance, but even if you choose to do so, it will not allow you to waive off of the Student Health Benefit Plan. In the United States, even with health insurance coverage, an individual may have additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription, and then the insurance plan pays the remainder of the cost of the visit or prescription. With the Student Health Benefit Plan, when you have services outside of Boynton, you may need to pay a deductible and co-insurance. Deductibles are annual dollar amounts which must be paid for services before the insurance plan begins paying anything. Co-insurance is a percentage of the claim that you must pay, with the insurance then paying the remainder. However, all our plans have a maximum annual out-of-pocket amount so that once you reach the amount, the insurance pays 100% for all remaining eligible claims. The Office of Student Health Benefits has detailed information on its website showing coverage levels for different types of services for each of the health plans. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. As Danielle said, Boynton Health is usually your lowest cost and most convenient place for medical care. In fact, most services provided at Boynton result in no out-of-pocket cost to those on the Student Health Benefit Plan. And for people on the Graduate Assistant Health Plan, they generally have just a $10 copay for services at Boynton. Now, Danielle had mentioned dental as part of the Student Health Benefit Plan. The Student Health Benefit Plan does have the preventive services that Danielle mentioned that you can get at Boynton for no cost, 2 annual checkups each year. On the Graduate Assistant Health Plan, there is a full dental coverage, and that would cover 2 annual cleanings per year, and then also have some restorative services for things such as crowns, bridges, and root canals. Now, for those on the Graduate Assistant Health Plan, the restorative services do have some out-of-pocket costs for you. The medical identification card you receive from the insurance company will have their website information, enabling you to find other available in-network providers when needed, such as if you require immediate care when Boynton is closed, or if you require a service that's not provided by Boynton. Our insurance company is called Blue Cross Blue Shield of Minnesota, and the provider network is called Aware. You'll need your medical identification card when obtaining services or picking up prescriptions at places other than Boynton. If using a provider other than Boynton, it's important to confirm that they're in network before obtaining services, as you often must pay more out-of-pocket costs when utilizing providers who are not in network. It typically takes a couple of weeks to receive your medical identification card. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We're here to assist you and help answer any questions you may have about your medical coverage. The next presenter is Katie Smith from Blue Cross to give you more detailed information on the medical plans and how to utilize your health benefits.
Thank you, Greg. I'm Katie Smith with Blue Cross Blue Shield of Minnesota. And today we'll talk about the health plans that are available to you either as a graduate or a student. We'll also discuss the group of providers that you can use, as well as the unique services and support to help you manage your health and your health plan. And you can go to the next slide, please. So we'll start out with just the health plan basics. Thank you. So as Greg mentioned, an ID card will be mailed to you upon your enrollment into the plan, which can take about 2 weeks or so. Your ID card is important because it contains your group number and your ID number. Those numbers are used to submit claims to the insurance company so that we can, pay a portion of that claim on your behalf. It's important to provide this ID card to your healthcare providers and your pharmacy when receiving care or prescriptions. The back of your ID card contains the website information to the member portal, as well as contact information to customer service. And it looks like they did drop those links into the chat for your reference as well. Now, I know Greg had discussed a few of these terms here, but I just want to go a little bit more in depth about basically just Healthcare 101. So health insurance is like a financial partnership between you and an insurance company to help pay for your medical expenses. You pay a certain amount regularly, known as your premium, and in return, the insurance helps pay for some of your healthcare costs when you need care. Your premium is what you pay to have the insurance, but this amount does not go toward your actual medical bills. Before your insurance starts covering much of anything, you pay a set amount each year, known as your deductible. After you pay your deductible, you and the insurance company split the cost of care, known as coinsurance. For example, you would pay 10% and Blue Cross would pay the remaining 90% of the cost after the deductible is met. Again, co-payments, also known as co-pays, are that small fixed fee that you pay for certain services. And then finally, the out-of-pocket maximum is the total amount that you will pay during the plan year for all eligible medical expenses. Once this threshold is satisfied, your eligible expenses are covered at 100% for the rest of the plan year. Now that you have a basic understanding of the common insurance terms, let's go over how seeking healthcare services works with insurance. First, you go to a doctor that's in your network and you bring your insurance card. If your plan has a copay, you'll pay the copay at the time of service, kind of like a cover charge for your visit. After your appointment, your doctor doesn't send you a bill right away. Rather, they send a claim to Blue Cross, which includes the details of your visit. Blue Cross then processes the claim and decides what they will pay based on something called the allowed amount, which is the price that an in-network provider has already agreed upon with Blue Cross for that service. It may not be the full price that your doctor normally charges. Typically, it's a little bit less than that amount. Then Blue Cross sends two things. We'll send one to your doctor saying how much we are paying and how much you owe, called a remittance. A notice is also sent to you called an explanation of benefits, or an EOB for short, which breaks down the details of your visit, including the provider's charge, the allowed amount, what the plan, Blue Cross paid, and then what you as the member owes. Once the doctor gets payment from Blue Cross, they will send you a bill for anything that is left, including any deductible charges or coinsurance. It is important to compare your EOB to the provider's billing statement to ensure that everything matches. If it doesn't, we encourage you to contact customer service so that we can assist you with the provider. Finally, you pay the provider for services rendered. One thing to keep in mind is that network matters, like Greg had said. If you see a provider that's outside of the Aware network, they can charge above the allowed amount and may not accept payment from us directly, meaning we'll send payment to you with the expectation that you pay the provider on our behalf. Next slide, please. Blue Care Advisor takes the guesswork out of managing your benefits. It's a comprehensive digital resource for both you and your covered dependents. You can see the details of your plan and what's covered, and it's personalized just for you. That means that the information and features you see are based on your benefits provided by the university. What's nice about Blue Care Advisor is you can access all of your benefits in one spot, from the medical plan details to program information, as well as prescription drug coverage. Blue Care Advisor pulls together your benefit programs in just one place. There is also an app that you can download from your Play Store, which includes a digital insurance card, which is great to have on hand in case you don't quite have your insurance card yet, or you're just on the go and you didn't grab one before you left. Blue Care Advisor can also help you know the cost of care before getting treatment, get help predicting your out-of-pocket costs before seeking care, and we can even recommend providers near you to make finding care simple. Receive support and important reminders about your care to keep you on track with managing your health. Yeah, that's it. Thank you. And now we'll shift gears into the provider network. So a provider network is a group of doctors, clinics, hospitals, and other healthcare providers that you can see for a lower cost. If you choose to see providers that are not in your plan's network, you will likely have to pay more for that cost of care. Knowing which network to use is important. So if you are seeking care in Minnesota, you'll use the Aware Network, which is our largest, most robust network, with nearly 21,000 primary care providers, 48,000 specialty providers, and 174 hospitals participating in that network. If you're traveling within the United States, you'll use the National Blue Card PPO network, which provides you access to more than 2 million in-network providers nationwide. Your costs will likely be higher if you use an out-of-network provider for care. There are some exceptions to that rule, including emergency room visits. However, it is important to check the status of your provider prior to seeking non-emergent care, and you can do that by using our Find a Doctor tool on our website or in our mobile app, or by calling customer service. Knowing where to go for care can help you save both time and money. When you need care, I already said that, sorry. Here are some care options arranged from least costly to more costly. I always recommend that if you're not sure where to start, you can start by calling your clinic or by calling Boynton. They may be able to connect you with a nurse who can help address your concerns and help determine if you need immediate care. Some clinics even let you have an e-visit with your physician online for information about a non-urgent medical issue. Please note that this may not be available at all clinics, but it's certainly worth asking. For problems such as flu, colds, and sore throats, you may be able to get fast, convenient help at a walk-in clinic or a retail health center. Doctor on Demand is an online provider that you can visit with your doctor on a computer immediately. You'll be able to discuss your situation and get the advice you need. If you have a webcam on your computer, you can even talk face-to-face, or you can do face-to-face on your cell phone. Now, your primary doctor's office is a good place for diagnosing and treating medical conditions. And many clinics have expanded hours and offer same-day appointments if you're feeling ill and need to be seen, a little bit more urgently. If your illness or injury is not life-threatening but requires prompt attention, you can visit an urgent care center. And then, of course, in an emergency, we encourage you to call 911 or go to the nearest emergency room. An ER visit can cost considerably more than an urgent care visit, so we like to, remind folks to use, emergent care only in emergency situations to help save some money there. So now I'd like to talk more about the Blue Cross plan that's available to you, what it is, and then how it works. So first, I'll start with the Student Health Benefit Plan. This is available to students who do not qualify for the graduate appointment. With this plan, if you're outside of Boynton Health, you will have a $250 deductible. And remember, that's the amount that you pay first before the health insurance plan helps pay for any of your expenses. The most that you'll pay on this plan per year for one person is $6,250. So what rolls up into that out-of-pocket maximum includes all of your deductible amounts, your co-insurance that you've paid, as well as your co-payments. The great thing about this plan is that your preventive care for both you and your dependent children are covered at 100% as long as you're using an in-network provider. If you're using an out-of-network provider for your preventive care, you would be responsible first for the deductible plus 20% of the bill charge thereafter. Provider services as well as professional services rendered in an office visit are typically subject to the deductible, and then after that you pay 20%. Doctor on Demand, again, is that online doctor that you can use. We encourage to use Doctor on Demand because it is convenient, but additionally, it's only a $10 copay and your deductible does not apply. Next slide, please. The Graduate Assistant Health Plan, Plan 1, has a very robust benefit schedule. If you're using in-network providers, there is no deductible, even outside of Boynton Health. You have a $10 office visit copayment, which the deductible does, well, there is no deductible, so that wouldn't apply. But you have a $5 copay if you're using Doctor on Demand. The most that you'll pay on this plan per plan year is $2,500 per individual, $5,000 for the entire family. But again, all of your preventive and well child care is covered at 100% when you're using an in-network provider. If you do need to go to the emergency room, it's only a $40 copay. But I'd like to call out, the difference on the in-network versus out-of-network on the side, because you can see the out-of-network, you will pay significantly more. So again, always encouraging the use of in-network providers. And then the Graduate Assistant Health Plan, Plan 2 is only for your dependents. A similar benefit structure. However, there is a little bit more out of pocket to pay on this plan. There is a deductible of $100 per person per plan year. And your office visit copayment does increase to $25 and then $10 for Doctor on Demand. Okay, I'd like to shift gears over to the prescription drug plan benefits for both the Student Health Plan and then the Graduate Assistant Health Plans. With your Student Health Benefit Plan, they help pay for formulary prescription drugs. A formulary is a list of medications that is covered under your plan. The Student Health Plan provides coverage for formulary drugs only and will cover up to a 30-day supply of a preferred, also known as a formulary, generic or brand drugs after either a $15 copay or a $25 copayment. Please note that specialty drugs and non-preferred or non-formulary drugs are not covered under the Student Health Plan benefit formulary. If you need resources on patient assistant programs or specialty medications, we encourage you to contact Boynton Health and they can help assist you with that. Both the Graduate Assistant Health Plan 1 and 2 covers both 30-day and 90-day prescriptions after you pay your copay. This benefit allows coverage for drugs that are not on the formulary, also known as non-preferred, as well as specialty drugs. It is important to note that on some medications on both the student and grad plans require a prior authorization, meaning that your doctor must provide clinical information for review and approval. Your doctor knows how to submit these requests, but customer service is happy to assist you with any questions that you may have about the process. The list of covered medications can be found on the website on the back of your ID card. These lists are updated quarterly, so it is important to check the formulary if you're prescribed a new medication to ensure coverage. So as a Blue Cross member, you have access to several health and well-being resources. Learn to Live is our online behavioral health therapy program that helps provide you with confidential support. They use interactive lessons to help you explore situations that trigger negative emotions and gives you tips and strategies to work through them. Learn to Live can help with stress and anxiety, including panic and social anxiety, depression, insomnia, substance use, and resiliency. Visit the website listed here and use code UMN to get started. And this is free for students and graduates. With Doctor on Demand by Included Health, you can receive fast, convenient care from a board-certified physician 24 hours a day, 7 days a week for many common medical conditions. All you need is a computer, tablet, or a phone. Licensed psychologists and psychiatrists are also available on Doctor on Demand, and you can schedule next day appointments. If you're covered under the graduate plan, again, you pay just that $5 copayment per visit. Any dependent covered under Graduate Plan 2 pays a $10 copayment. Those covered under the Student Health Benefit Plan will pay $10 copay. So visit the website or download the app from your Play Store to get started with Doctor on Demand. Healthier babies begin with healthier pregnancies, and maternity management program can help. A maternity nurse provides one-on-one support during and after your pregnancy to help prepare you for your new arrival and provide guidance on staying happy and healthy after your baby is born. Contact customer service or call the phone number listed here on the slide to enroll in the program. Quitting tobacco and vaping is hard, but you've got some support. A wellness coach will work with you to develop a quit plan tailored to help you identify potential hurdles, create strategies to manage urges, and offer online resources to help keep you on track. Contact customer service or call the phone number listed on the slide to get started today. And I just want to say thank you, everybody, for spending time with us this morning. We're here to help. I've provided the customer service information here as well as our Find a Doctor tool for your reference. We are always here to help you in case you have any questions. I know I went over quite a bit of information for you, but we're happy to have you. I appreciate your time this morning, and I'll turn it over to Cody. Thank you.
Thanks, Katie. Hi, everybody. My name is Cody, and I work in checking in new students. I'm just here to remind you about new student requirements. All international students must complete a checklist specifically for ISSS. We call it the New Global Gopher Required Tasks. You can see a picture of it here. There is a section for things you do before you arrive and a section for things you do right after. This task list guides you through requirements you must complete and information you need to know as you prepare for your first semester. To ensure that these tasks get done, ISSS will place a registration hold on your account on August 27th if you have not completed these required tasks. You will not be able to register for classes or change your registration until the tasks are complete. If you complete the list before August 27th, no problem, it won't affect you. That's what we're going for here. My advice is to start early. Be ahead of schedule, not behind. On the next slide, you can see one of these pre-arrival tasks, iPrep. The International Student Preparation course is separate from the Orientation Prep course and is just for international students. You need to do both. iPrep is an 8-part online course full of very useful information about visa regulations, academic culture, what to expect when you arrive, and more. It will take a few hours to do, so don't wait until the last minute. Now, this has been a lot of information, and I imagine you have questions. So I'm going to turn this over to Youth to move us into our Q&A.
Thank you so much, Cody. And I believe there's a lot of information. So it can be easy to feel overwhelmed at this point. Before we jump into the Q&A sessions, I would like to invite you to actually do an awareness activity with me before we actually start diving into the question that we have in the Q&A section and pre-submitted question. I'm going to ask everyone to actually now, if you're sitting down, put your hands on your lap, look around the room, or wherever you're sitting, pay attention to one item that is most present in that space. To me, right now, is a plushie of a Piplup, if any Pokemon fans here know. It's blue, it's a penguin, it's very cute, it's sitting in the corner. Take a long, deep breath with me. Look back to the computer and the screen. I know, as a teacher who teach an online class, I know that screen time is oftentimes require a lot of energy. And it oftentimes a reminder to a lot of my students to take a breath. Review what is around you in that room. You are not just a space within the computer screen. You are more than that. That space is where your resting and breathing can come from. Hello, everyone. I'm Yutz. I'm a graduate consultant with Culture Corp. I'm also an international student from Cambodia. I have seen a wonderful list of questions in the Q&A section, and I also reviewed some of the pre-submitted questions. Hopefully, we could get to many of those today. And just like you, I had those exact questions when I actually started applying for and preparing myself for the US as well. I cannot believe it's been 4 years, and I have been using a lot of the advice I have from Katie, Greg, and Austin's on many of those things. So I'm actually excited for the Q&A sessions for today. So I think the first questions, I'm going to actually pass it to Greg. There's a question from our participant today, which we hope to answer live. When does the health insurance coverage start? Is it the first day of the semester? And if we are arriving before the beginning of the coverage, how can we access healthcare at the meantime?
Yeah, so there's a couple things here with this is ultimately you can have coverage from the moment that you arrive in the United States. Now, officially, or I should say sort of automatically, how does the coverage start? So automatically, on the student health benefit plan, coverage would start on August 25th, and automatically on the graduate assistant health plan, coverage would start September 1st. Now, having said that, you're going to get your ID cards sometime after that. So the question really is, what do you do if you need health care prior to that? Because you can have coverage from the moment you arrive in the country. And so ultimately, if you need services prior to those dates, you want to contact the Office of Student Health Benefits, and they'll work with Blue Cross to get you enrolled earlier than the coverage dates that I mentioned, so that you can get services.
Okay, thank you so much, Rex. And I think with in regard to early arrival, I think we also have one question pre-submitted as well for Austin. So Austin's, do we have any temporary accommodation available from August 18 to September 1st? Are there early arrival housing options available?
Sure. So to answer that question, we would really only have temporary accommodations during that time if you already have a housing contract with us in Housing and Residential Life. So if you plan to live on campus in the fall, the answer is yes. If you do not, unfortunately, we only have early arrival housing for international students from July 27th to August 22nd. So you could stay with us for a few days, but we would need you to move out by 6 p.m. on August 22nd because we need to start making room for all the people who will live with us on campus that first year. So in short, if you're living off campus, you might need to find accommodations elsewhere if you're arriving that late, but do know that we will take early arrival housing for international students until the 22nd, but from the 22nd to the 1st, you have to find other accommodations. You can see more information about early arrival housing at housing.umn.edu/international. That includes the dates and the cost for early arrival housing.
Thank you so much, Austin. I have the next questions for, I believe is for Greg as well. Will those on graduate assistant health benefit plan also receive the vaccination for free?
Yeah, so in terms of the vaccinations, there's a list of essentially preventive type vaccinations that whether you're on the student health benefit plan or the graduate assistant health benefit plan, there would be no cost to you. So for example, those required vaccinations such as measles, mumps, diphtheria, COVID, and flu shots, those are all no cost to folks, whether they're on the student health benefit plan or the graduate assistant health plan.
Yes, and I think we have a follow-up questions, which I think I had this at the beginning as well to Greg. Should graduate student who will start with a fellowship award and later shift to a research or teaching assistantship also enroll in graduate assistant health benefit?
Yes, they should.
Thank you. I believe the next questions would go to Katie. This is a very general, wonderful question to ask. As a first-time student back 4 years ago, I have the exact same question. Is Blue Shields an alternative to Boynton Health?
That is a great question, and the answer is no. So Blue Cross Blue Shield is the insurance that helps pay for the services that you provide, that you receive rather from, medical providers, where Boynton Health is an actual medical provider. So they are not one and the same. The insurance plan helps pay for services at Boynton.
Thank you, Katie. And definitely, so that's a early confusion given the fact we are coming from different systems. So it's expected a lot of healthcare systems are different. The next question I think is directed to Daniel. We have a pre-submitted questions that I think is also in the preparation phase. Also, a lot of international students. What document or ID should students bring to prepare when visiting Boynton Health or services, like picking up medicines or attending counseling session?
Thank you. Your U-card for identity verification and access to campus services, your insurance card to ensure proper billing of services, and normally a form of payment in case you need to pay for a copay, but that's the basic information that you need.
Thank you, Dan. I have also a follow-up question as well, maybe to both Katie and Daniel. Should international students transfer their medical record from their home country, or what type of document they should bring with you as a medical record?
For Boynton, it's not necessary unless your provider specifically requests them. Let's say someone with a chronic condition and it's important to check their records. In that case, yes, but normally it's not necessary.
And I can kind of add on to that too. Most providers, they may ask for it, but it's really going to be up to that individual provider. And again, I'll just kind of relate to what Daniel said. If you have a chronic medical condition, it may not be a bad idea to transfer those medical records, but I would certainly have that conversation with your provider before doing so.
Thank you so much, Daniel and Katie. That is also wonderful. I know preparations for traveling is also including preparation for document. I remember I have like a large folders of file that I haven't used since I brought here. So that's always a great question to ask. I think the next questions is for Austin's, as of right now, that's a good question too. It's summer. Are dorm open during break? And what about off-campus housing?
That's a great question. So certain buildings on campus, certain residence halls on campus will be open during breaks. In particular, like winter break is the one that people have the most questions about because it's the longest break. So in between fall and spring semesters, certain buildings will be open. If you live in that building, great. If you do not live in that building, we can help relocate you to another room in a building that will be open over break. Keep in mind, meal services is limited during break, and general campus amenities do tend to be more limited during break, but we still operate in certain buildings on campus. So when that occurs, we will send out more information about winter break housing later in the fall semester. Off-campus housing is available during your entire lease term. You are entitled to that space during your lease. And so make sure to review your lease if you're living off campus to see those dates. They're almost always going to be on the first page of your lease, maybe the second page, and it'll say the lease starts on this date and ends on this date, and you are entitled to that apartment during those dates.
Thank you, Austin. And as a graduate assistant, I'm currently living off campus, and there's a lot of options for you to actually explore those as well. Many of which the lease ends somewhere around August. So feel free to actually pay attention as you sign those lease and prepare accordingly. Summer can be a very transitional time for a lot of housing processes, so it's always great to explore that. We have a lot of questions. I think I'm opening this to Katie, Greg, Daniel, and potentially Marina and Ali as well. This question is also big and also our biggest concerns for a lot of international students. So, and are there any financial assistance for students who struggle to pay medical bills?
I can jump in real quick. I mean, the university does have a student emergency fund. It looks like Amora just put the link in there. And so if you do have, a significant issue, whether it's medical or any other type of thing, you could apply for this for some assistance through this particular fund. Now, I should point out that this is not designed to just sort of be routine type of expenses, but it really is, you know, some sort of significant unforeseen expense that this particular fund might you might qualify for.
And I can just add
Grant.
too, on behalf of, providers outside of the university campus, a lot of providers do offer financial assistance programs. They can also set up payment plans. So if you ever kind of run into a bind and not sure what to do, we always encourage you to call the provider's office and ask to speak to their financial department. A lot of times there's grants available, or like I said, payment arrangement can be set up. So certainly work with your providers. They're there to, help you even with those bills.
And I
And
think the one-
additionally, oh, go ahead.
Sorry, one more follow-up kind of on what Katie's saying. If you remember the description of the various, coverage levels on the plan, the two things that can end up costing you a lot of money is if you're going outside of Boynton on the student health benefit plan, because then you have the deductible and then you have 20% coinsurance. If you stay at Boynton, you normally don't have to pay any of that stuff. So you have minimal or non-existent costs at Boynton. And then on the graduate assistant health plan, the thing that can really get you in trouble is the out of network stuff, because whether you're at Boynton or going to in-network providers on the graduate assistant health plan, you most of the time have basically a $10 copay.
Thanks, Greg, for clarifying that. I know a lot of students oftentimes are wondering just the cost in general. So again, echoing using Boynton services, making sure you're going in network. You can find out who those are, but like Boynton is usually a really good place to go when you're covered by the university student health insurance plan. ISSS also has limited but funding for international students experiencing emergency costs, including, for example, going to an emergency room, a hospital. Those are sometimes you just can't choose, but that would be a perfectly good example of a reason why you would be able to apply for emergency funding. Again, if you're able to plan out some of these medical costs, make sure that you go in provider, that you go in network locations, because that will ensure that your costs stay very low to not having to pay out of pocket. So
thank you, everyone. This is actually very wonderful to hear. As an international student, I think it's always great to financially plan. And I think it's not just individual. I'm leading toward the next question, which is a little bit more gearing toward families or international students, specifically graduate students like myself who are coming in with family members. Does the university offer family health insurance? And in case, like if you have babies or you have a spouse with you, what would be some of the options?
Sure, both plans do allow dependents to be on. In terms of the cost, it'll vary based on which plan and whether it's, a spouse or a child or full family. And so I'd encourage you to go out to our website, shb.umn.edu, and then click on the various plan, either student health benefit plan or graduate assistant health benefit plan. And then you can see what the cost of coverage would be if you added dependents.
Thank you, Greg. I will also pass to Ali if you actually want to share anything as well regarding your experiences navigating those family plans.
I guess, yeah, thanks, Youth. Like as Greg mentioned, there are options for family insurance. I myself have my wife. We also have a baby, so we have been through the pregnancy and the labor and all of that, and we are on the graduate health plan for me and my wife, and it has been amazing. We haven't had to pay almost anything throughout the pregnancy and the labor. So I guess like reiterating on that, like the being in network, make sure you either stick to Boynton or like check with in-network providers, and then if you are on the graduate health plan specifically, it covers a lot of things. Yeah.
Yeah, thank you, Ali. I think there's also something very important in immigration-wise, and I think I want to invite Mary Beth to chime in after you actually navigating this conversation. Mary Beth?
Hey, I'm
Yeah.
here. Can you repeat the question?
Yeah, so the question was actually about, does the university offer family health insurance, or if you have kids here, what would be some of the navigations? And I think it's also wonderful to also hear from you as well. How is the US citizen dependent work in this process?
Yeah, great question. So there's a little bit of a difference here when we're talking about health insurance for you and your family, and then the immigration side as well. So if you're an international student and you are here with a spouse or child who's a dependent, an F2 or a J2 dependent, you are required to add them on your health insurance. But this can get a little bit confusing when, let's say you are in the US and you have a child while you're in the US. Your child would be considered a US citizen. So you would not add them as a dependent on your I-20 or your DS 2019. In most cases, you are still going to be required by the university to have health insurance for them. And that's a way that we can help you care for your family, is by having healthcare for them. If you have any specific questions though about, you know, kind of navigating these challenges, please reach out to ISSS if you have immigration questions. And then of course, Boynton, the student health benefits plan, they will be able to help you navigate as well, adding dependents on your insurance.
Thank you
Thanks.
so much, Mary Beth. That's always some things that is important to pay attention to if becoming a dependent. Apart from the immigration status, is also the dependent's insurance plan that actually attached to yours. So always pay attention to that, and ISSS and everyone else in this Zoom call, I'm more than happy to navigate and support you through the process. I'm going to go back to some of the live questions that we have. And I think this question is directed to Austin. Could you please provide the date for housing assignment for students?
Sure. So our housing assignments will go out by the last week of July. You should expect that no later than August 1st. And then, as I mentioned in the presentation earlier, we have various move-in dates depending on if you're moving into an on-campus apartment versus an on-campus residence hall. So those dates are back in the presentation and also available on our website. But you can expect to get in a housing assignment if you signed up for a contract no later than August 1st.
Yeah. Thank you, Austin. And I think this potentially going to any of the panelists actually would like to answer is, are health plans necessary for all international students? And what if I do not wish to have one?
Yeah, so actually I'll answer this. The university requires everybody to have health insurance. So it's not even just, you know, unique to international students. Everybody at the university has to have it. In terms of international students, yes, they have to have the university available plan, either the student health benefit plan or the graduate assistant health plan, unless they qualify for a waiver. And again, the only countries that qualify for that waiver are the ones that were mentioned before. Don't have the list right in front of me, but it's basically Oman, Saudi Arabia, Kuwait, United Arab Emirates. So if you're from one of those countries, then you can work with with Office of Student Health Benefits to waive off the student health benefit plan. But in the event that you're not with one of those countries, then you're going to want to enroll in the graduate assistant health plan if you're eligible for it, because it is so low cost If you're not eligible for that one because you're not a graduate assistant, then you do have to be enrolled in the student health benefit plan.
Yes, thank you, Greg. And I think this is very common. And I think we talked about this multiple times too. There's so many things to navigate. So I believe this is a live questions and also potentially a share concerns too. I am still confused between GAHP and SHBP. What is the main difference and which plan is best suited for either a GOA or a GTA, which I'm assuming graduate research assistants or graduate teaching assistant?
So again, it all comes down to whether you're eligible for the graduate assistant health plan. If you have an appointment, fellowship or TARA, so that you can be on the graduate assistant health plan, then you want to be on that one, because if you remember the various coverage things, you have a lower deductible, you have a lower out-of-pocket exposure for medical services, and you have a lower contribution towards the premium. So if you're eligible for that one, you want to be on that one. If you're not eligible for it, then you're going to have to be on the student health benefit plan, which, unfortunately, because on the student health benefit plan, there is no employment relationship with the university. That employment relationship that you have on the graduate assistant side is why your contribution is so low. The university is making a significant contribution towards the cost of the coverage for the graduate assistants. But on the student health benefit plan, there's no contribution from the university, and that's why you see that premium is so much higher. They're both going to cover more or less the same services. It's just a question of what the copay is going to be, or what your cost share is going to be on it. So again, enroll in the graduate assistant health benefit plan if you're eligible, and if you're not, then it's the student health benefit plan.
Yeah, I think I also would like to jump in. I am, and I think this is a great question too. I am both a graduate research assistant and also a graduate instructor. Oftentimes, I think once you actually work for the university, what we call 50% appointment, you are actually eligible to apply for those graduate assistant plan. And I think it's also linked to one of the biggest questions too. Greg, I'm going to ping this back to you too. It's just conversations around possible or require amounts of working hours. Is eligibility criteria depend on the credit hour or services hour for graduate assistant?
Yeah, so good point there. So to get kind of the full contribution, right? You had mentioned 50% appointment. So if you have a 50% appointment, that's when the university is, making a really large contribution towards the premium. And if you remember in the presentation, I said, in that scenario, you're only going to pay basically $235 for the entire semester. So it's a one-time charge of $235. Now, any graduate assistant is eligible to be on the graduate assistant health plan if their appointment is at least 25%. So people who have an appointment of 25% to 49%, they're still eligible, just like the people who have a 50% appointment, but they will pay more than that $235 that I mentioned. There'll be kind of a sliding scale of what they pay. Still a great plan. If you have a 25% appointment, you're still going to want to be on the graduate assistant health plan because it'll be cheaper than being on the student health benefit plan, and it is even better coverage.
Thank you, Greg. And I think this is one great reminders too. I'm a graduate assistant myself, so if you heard the word 25%, that equivalent to 10 hours. If you actually hear 50%, that equivalent to 20 hours. As a teachers, in other words, a graduate instructors, I teach 1 courses. That's equivalent to 10 hours or 25% appointment. So I teach 2 courses per semester. That's equivalent to a good 20 hours works and 50% appointment. So there's not a lot of way for you to actually navigate those numbers, but within your letter of offer, you will see the percentage and amount of hour expected of your working employment. So feel free to actually look into that. And it's very common for you to work and basis. It doesn't matter how many you are actually working for, as long as you accumulate it to that amount. Because currently I'm actually working in different departments. So as a graduate assistant, I actually take advantage of the graduate health benefit plan quite a lot. Yes, and I think we actually having a little bit more time for a few more questions. So we actually now moving to the questions about the general deadline for housing. So I'm going back to Austin. Would you be okay providing us a general deadline or a general date for the housing itself?
Sure, yeah. So once you get your housing assignment, we will ask you to schedule a move-in appointment. And so once you get that in the mail around August, or I'm sorry, email around August 1st, we'll ask you to schedule your move-in appointment based on that. Otherwise, the general deadline if you want early arrival housing is that you got to basically apply for that before August 25th, because by that point, you'll be moving into your permanent location.
Yeah, thank you, Austin. And I think I'm going to also ask Amora to drop some of the list of key dates in the chat as well. It would be super helpful to get that memorized or copied somewhere. And I think we're moving to the questions a little bit regarding determining copay. So I'm going to ask Daniel and Greg for this question. How can I find out if my insurance covers a specific service at Boynton? How can I determine the amount of my copay?
Would you mind replying to this one, Greg?
Yeah, I'm sorry, I was focused on something else at the moment. So I got the general question is, how do I know how much my service is going to cost at Boynton? Is that more or less what the question was?
Yes, and also a conversation around copay as well. It's like how much do they have to pay in addition to the insurance?
Okay, so in terms of Boynton, it's going to ultimately be, again, whether you're on the student health benefit plan or the graduate assistant plan. So most services on the graduate assistant health plan result in a $10 copay. So if you come in and you've got a sore throat or whatever, and they just look at you and whatever, that would basically be a $10 copay on the graduate assistant health plan. On the student health benefit plan, most services actually result in no cost for you. So there would be, for that same thing that I talked about, you'd have no cost. Now, prescriptions, however, you will have a copay. If you remember, Katie had gone through prescriptions, so you will pay the $15 copay on the student health benefit plan for generic drugs and $25 copay for brand name drugs. I believe it's 15 copay. I believe that's the same for graduate assistant health plan. It might be slightly different. It's on ours, but again, you'd have that copay. Ultimately, if you're having some other service, I mean, I guess all you can do is ask about the various service. Now, one of the problems is that, when you come in, you don't always know what you're going to be diagnosed with, right? So, and ultimately what you pay, whether you're going to Boynton or someplace else, is based on diagnosis codes that get submitted by the provider. So again, if you go to a non-Boynton provider, anything that's considered preventive care is free with no copay, but you don't always know what that's going to be before you come to the provider. So it's very difficult, I think, to guarantee that a person won't have an out-of-pocket cost, because again, you don't know what the diagnosis is going to be until you've actually come and been seen by the physician.
Thank you so much, Bragg. We have some questions for the student leaders as well. So as student leaders, let's talk about some tips. Is there any advice you would give to new international students about how to stay healthy and well any resources you would like to recommend. So I think I'm going to pass it to Amora and Ali's first, and I will share mine at the end. So Amora, Ali, who would like to go first?
I can go first. Thank you, youth. I mean, no one wants to be sick during exams or even midterm season. So I would recommend everyone to stay active. And maybe from my personal experience, I could recommend you to try summer biking, especially in the summer. So I recently bought a bike, and I'm biking from UMN campus to Aldi. And if you take the public transportation, it would take around an hour. But if you bike there, it would take 15 minutes. So there's like a very big difference in terms of time, and you're also being active. So biking around Minneapolis, biking around campus is very beautiful, especially next to the lake. So definitely staying active. There's also a reuse program the UMN has where you can find cheaper biking. Someone can drop the link below. But during winter, I would say stay active indoors. So the Recreational Wellness Center has soccer fields, badminton court, basketball, swimming, anything you can imagine, even rock climbing, anything you can imagine. So I would definitely recommend staying active in the rec wall. And also during winter, you've probably all heard of how cold the winter gets. So I would recommend staying warm, making sure you have a thick jacket, a hat, gloves, winter boots. And I have friends who don't like to wear hats when it's -30 Celsius, -30 Fahrenheit, just because they think they look silly. But I think staying healthy and warm is really important. And everyone essentially looks like a penguin here during winter. So please don't worry about how you look, and make sure to take good care of your health. So I'll pass it on to Ali.
Yeah, thanks, Amora. I think Amora covered very good points. The thing I might add to what Amora said is also nutrition. So make sure you have healthy food. You kind of like take care of what food you eat. Sometimes when you are like stressed, you have exams, you might compromise your meals and like kind of like eat anything. And some unhealthy options are easy to pick. So I would say stick as much as you can to the healthy food. Also, sometimes if you have a meal for a few days in the fridge and that's the only thing you have, just make sure it's still good to eat. Because sometimes when you are in a rush and you want to study for exam or something, you just eat anything and maybe after that it's kind of like hurt you. So make sure you have good nutrition, also stay active, as Amora said, warm in the winter. And yeah, take care of your well-being. If you like to hang out with friends, do that. If you like to go for a walk, do that. So just make sure you do whatever makes you kind of like taking care of your mental health. So yeah, I would pass it to youth. What do you think?
Yeah, I do agree, Amora and Ali. I think prevention is always better than reactions. And it is the biggest hope to not use the health benefit plan at some point, even you pay for it, because I wouldn't trade being healthy over being sick at any point. I think it's everyone, all the other speakers might agree with me. It's like seeing them as the worst case scenario, right? Is after you actually have an issue. So take care of yourself mentally and physically. I think one of the tips I would have as both an instructor and also a student myself, it's easy to lose yourself during the sprint period for the finals or the midterm. It's very tempting that you might stay up late, just try to finish everything. One thing I will keep reminding my students and also my friend is do everything in moderation. Consistently and slowly. Great study group as you need to. Do not actually doing anything in one fell swoop. Space it out. There's can be a lot of credit load at certain point of the semester. Finals and midterm might come at the same time for your multiple classes. So space out accordingly. Don't try to sprint within just 1 week. It's like week 8, semester's midterm is coming, so I'm gonna do all the midterm sprint today. Do not do that. Strongly not recommended. So your mental and your physical health are all associated. So just like Ali says, right? Check up your fridge, but then when you're so in a rush, you forgot to actually check the expiration date on the foods. And there you go. You visit to the Boynton, you see Daniel, and then you felt like, oh no, I should have taken care of myself. You miss a midterm. Worst case scenario. I like to create a scenario with my student all the time, but the fun part about it is always pay attention to your daily habit, do everything in moderation. Do not actually go in everything all in at once. And of course, it's not just physical, but mental health as well. Amor and Ali talk about a lot about good tips of staying active physically, but also staying healthy mentally is important. Boynton has a very good mental health services that you can actually access, and has a lot of counseling services available on campus that I strongly recommend you are engaging with. Conflict resolutions, mental health care, mental health clinic. All of those are all resources for you, which is often covered within your benefit plan, or potentially a $5 to $10 copay if needed be for one session, which I think very affordable for, let's just say, healthy. And yeah, it seems like we are at the end of our Q&A sessions time. I know there's a lot going on, a lot more questions that we could have answered, but worry not, you are welcome to also explore some of our questions at a later time, review this at a time as well. So thank you so much, everyone, for your wonderful questions, and all the presenters for your wonderful response as well. I'm going to pass the floor back to Amora for the next part of the sessions.
Thank you so much, Youth. Now, how do we stay connected with ISSS? There are so many ways to stay connected as an international student, including the new student website in ISSS at isss.umn.edu/new, and our Global Gopher Experiences website, which will be added to the chat. You can also contact us at issssnew@umn.edu via email, and an ISSS staff member will respond to you. And as an international student, please remember it is never wrong to ask questions and connect with an ISSS staff. So again, welcome to our Global Gopher family, and make sure to follow us on our social media channels, which is ISSS UMN on Instagram as well as Facebook. And as for our next event for all students is Level Up for Career Success, which will be held on July 30th from 8 a.m. till 9:30 a.m. Central Time. So if you are interested to learn about career success, leveling up for a career, please don't miss it and make sure to register in advance. And thank you so much for everyone for joining our webinar today. And we look forward to seeing you all on campus very soon.